Thinking about building a smart city, creating jobs, a better life for all, one thing makes it possible: life. On this episode, we focus on developments in Lagos State's health sector as it strives to build a skilled, but most importantly, a healthy workforce. I'm Onyi Sunday, and this is Destination Lagos. The Ebola outbreak in 2014 marked a turning point in Lagos State's health sector. It brought to the fore challenges and potentials in the state's health sector. In the past few years, healthcare in Lagos State was described as free, as patients paid little or nothing in the general hospitals for treatment. With a population of over 22 million people and counting, this was not feasible. To ensure a more sustainable and unhindered access to healthcare, the state's Ministry of Health embarked on renovating, building, and equipping primary health centers in the state.
We're using both private and public providers to provide services at the different levels of care. So even if government doesn't have enough money to build more primary health care facilities, you don't even need to build more. You can contract the service of the primary care providers and private sector to provide primary care for as long as you're not guaranteeing some form of payment. And in the same process too, if you can guarantee services now at the primary health care sector, you reduce the pressure on the secondary and tertiary care sector so that they will be able to do their specialty functions. And that way, if you really have to create a proper referral system. And now in that system now, you cannot enter the health sector except through your primary care provider. It's what they cannot treat at that level of care that they now refer you to the secondary care provider. If you circumvent that, you pay through your nose. It's a way of setting some degree of order into the system.
Esther Patrick, a resident of Aboru Agbado Okiodo local government area, was a frequent visitor at a general hospital far away from her residence. Her first 2 pregnancies were difficult, and it had nothing to do with expected labor pains. The PHC in Esther's local government has also saved her 90% of medical bills she would have incurred at the general hospital.
My previous 2, I had it in general hospital, and the distance is a little bit far. The stress, going so early in the morning, coming back late because there's so many populations. But here we just come in. The nurses are so friendly, they are good, they attend to us so nice. In general hospital then, registration, apart from the blood donation, registration and everything, at least up to 30,000 per year. Registration and delivering is just 3,000.
At the second care level, renovation is still ongoing, the same thing. However, now, for some hospitals now who provide maternal and child care, reason we built that. That's why we built maternal and child centers, past government, which are still functioning. For the last 3 now, we are trying to complete, doing this to increase the access of care to sources. So, all those are there. Now, there you have specialty services, neonatal care. One of the causes of mortality is death of children in utero or immediately after birth, neonatal care, sepsis, jaundice, all those things. And once you can detect them early enough, you can treat them and reverse the consequences on the child, affect the child's growth. So you build up those capabilities at the secondary care level, at the first level of referral.
Upgrading transport infrastructure has contributed to healthcare delivery in most local government areas in Lagos State. According to Ogumbo Olushola, improved infrastructure have opened her community to the rest of Lagos State.
If they should tell me 20 years more time to come, this area will be like this, or we'll have a primary clinic center here, I'll argue with the person, seriously. Especially the road, this clinic, and I can see and I know we are going to achieve a lot of things in this clinic. Because most people go to quack nurses. Through that process, they lose their babies. Some during delivering or during labor, they will hit their head on the floor. It will lead to mental problem. But with this health center, I know it will, even if they're going to collect money, it won't be it will be affordable.
Primary health care is an integral part of the health system. It caters to residents at grassroots. Its importance cannot be overemphasized, as service delivery at this level is known to be affordable and accessible.
In Lagos State, we have about 320 primary care centers that are located in everywhere, the wards, the local governments. And we have those, there are some ones that are actually designated as comprehensive health centers where we run 24 hours. There are 57 of such, i.e. one in each local government and LCD. We make sure that we started renovation of those ones. We started equipping them with the state-of-the-art equipment. And I will tell you that last year, His Excellency magnanimously approved a sum of 1.5 billion to do that.
Our commitment to the improvement of the primary healthcare system is unshaken.
To ensure health services at the doorstep of every Lagos resident, the Lagos State government established a special program unit whose responsibility it is to make sure health care is available to the vulnerable, the underserved, and hard-to-reach areas. On the 1st of March this year, the unit launched a free health program known as the ECO Free Health Mission, catering to over 3,000 patients per day in every local government area. The ECO Free Health Mission has seen over 2 million residents in the state.
What we would normally do is set up camp at a designated area. We have 5 units. We have blindness prevention units. We have general outpatient units where we just offer primary health care. We have health education units. We have the HIV testing, counseling, and treatment centers. Then we have dental care. The strategy really is to take this program to places that are near primary health care centers, because we have realized over time that the health-seeking habits of Lagosians, especially that vulnerable group, is very poor. And the program is free. Medication is free, interventions are free, health education is free. And what we say to them is, after this period of time, visit your nearest primary health care centers. And the program is still going on because we actually have measured impact scientifically, and we've seen that after each outreach, the attendance at the PHCs spike incredibly.
The Free Health Mission provides the state an opportunity to understudy the areas visited and the diseases prevalent in such areas, which helps with research and data collection. Information gathered is usually shared amongst various health units, including the Center for Disease Control, for further analysis.
I will tell you about the Goiter Corrective Surgery Program. This program came about after we visited a particular area in Lagos State, Badagry specifically, and we noticed that out of every 80 patients, 1 had a neck swelling. So it raised suspicions that this is not usual. Why is this goiter thing? Why is the incidence high or the prevalence high in Badagry? We actually went back to do studies. We administered questionnaires. We did a KAP studies, knowledge, attitude, and practices. And we realized that it's just a lack of knowledge and their attitude that has caused this. It's a riverine area. The government provides iodized salt and water because goiter is caused by lack or an imbalance of iodine. But because it's a riverine area, they tend to deal with fresh water more than government waters. So we came up with an intervention and also prevention. Intervention in the form of surgery. We actually did almost over 1,000 surgeries. This started 4 years ago, and it's still ongoing. We have also done a lot of health education and advocacy on prevention. And this time our target audience is not the adults. We have gone to schools, we have gone to primary schools, we have gone to secondary schools, we have gone to religious homes to educate on how to prevent goiter. And interestingly, our register is becoming empty. There are less and less patients to deal with.
Lagos State has a fast-growing population, and the government anticipates that the mission might soon come under pressure. The Lagos Health Insurance Scheme is one way the government hopes to tackle the pressure head-on.
The package that we're offering is called the Lagos State Health Plan. It's a basic minimum package. Most of the services there are under primary health care. Of course, it's focusing on maternal and child health. So we have delivery, we have immunization services, family planning services, and so on and so forth. And that is something that we feel, would be able to meet the health needs of the average Lagosian.
Look at, again, the proportion of the population who are poor, who cannot even afford to pay for health care. That's a major issue. And as a responsible government, we felt we need to address that. In the past, government talked about free health. It's a financing scheme too, type of financing, but worldwide it's known globally that cannot work. It's not even possible to provide free health to everybody. Health is such that it should be contributory. The government has a role to play. The people themselves have their own roles to play.
So as long as you put a little token as your premium, depending on your level, your social status, you would access health through the health insurance, either the ones that are being run by governments or the ones that are being run by private entrepreneurs. We are going to charge equally at the primary care level, because the government is only given the enabling environment, and the government is going to control it, because the charge would be verified by a farmer who would have done both the accreditation and making sure that at least those services are being rendered.
And of course, now you're giving the people a voice. If I'm contributing money, then I have a right to tell you I'm not happy with you. So if the people are not happy with a provider A, the person has a choice to change to another provider.
The mission to build a healthy workforce in Lagos State continues after the break. Stay with us. Welcome back. If you're just joining us, you're watching Destination Lagos, and the focus is on developments in Lagos State's health sector. The health of a nation is a reflection of the wealth of that nation. This is common knowledge. It is also common knowledge that the health sector in most African countries have major infrastructure challenges. Addressing these challenges is a priority in Lagos State. The hospital is Lagos State's only tertiary teaching hospital. It's one of the health facilities undergoing an upgrade.
This hospital trains medical students for the state. And then we also train consultants. There's an active residency training program in the hospital that builds capacity for consultant service in the state. And it's arranged in such a way that medical officers who have passed the prerequisite exams that are working in the Health Service Commission are sent here for training to become consultants. And eventually, when they graduate, they will be distributed all over the states for service delivery. I make bold to say that this hospital has capacity in terms of equipment, in terms of staff, to give them the prerequisite training that makes them able to perform everywhere. And then, of course, we also attach 1-year training. We ensure that some of these candidates, some of these doctors go to India, where they can have hands-on training. We were given the opportunity to visit India about a year ago and made arrangement with some institutions that will allow our residents and even our consultants to go and update their skills.
The driving objective of LASUTH is to reduce the number of patients seeking medical care abroad. To achieve this, the aim to become a world-class teaching hospital using cutting-edge technology and highly developed human resources to provide excellent medical care to the people of Lagos State and beyond. The critical care unit of LASUTH is also well equipped with modern facilities to ensure smooth operations.
The intensive care unit, we have the ceiling pendants to supply oxygen. That way you don't have to bring oxygen into the room. We have a gas room where the oxygen plants are, and it's an automated system where we never run out of oxygen at any time, the way it's designed. In addition to that, we have proper ICU beds, multifunctional electric. We have ventilators that are commonly called life support machine. I don't think there's any teaching hospital that has this many ICU beds. We have 14 ICU beds here. And each one of them has its own monitor. We have infusion pumps, we have syringe pumps, we have 10 of the ventilators. And our monitors are multifunctional. They can do so many things, including measure the blood pressure directly from inside of the blood vessel. The operating room is set up for us to be able to do any type of surgery. We can do transplants. We do hip replacement surgeries. We do knee replacements. The operating light in the operating room has a built-in camera where we can actually record the cases that we're doing. If we need to do training, the students don't have to come in the room. We can actually transmit what we're doing to anywhere in the world. This is a teaching hospital, so there is no medical or surgical specialty that is not available in this hospital.
LASUTH isn't the only health institute getting an upgrade. The State's College of Medicine is also on the list.
Funding is quite essential. Now, we are funded almost 99.9% by government. That's an advantage. It's also a disadvantage. So, of course, it's a disadvantage because government cannot answer to all your needs. I can assure you, for 2017, everything we requested, we were meant to justify them, was answered and approved. But what government is giving us is 82.6% of that approved budget. Of course, that's their own monitoring thing. And I have attended a meeting at which the governor said that even if he's not making 100% income, he will fund health and education to 100%. And he's doing that.
The helipad is one of the hospital's biggest upgrades. It's one thing to have a fully equipped hospital and another to have the skilled manpower to run it. The state's teaching hospital and College of Medicine have been equipped to do just that.
Along the line, we picked on another medical specialty, which is dentistry. Now, that's our selling point now. I mean, an additional selling point. In Nigeria, we have about one doctor to about 35,000 patients, one dental surgeon. So for Lagos State University College of Medicine to have dentistry school, to produce dental specialists, Lagos State is contributing to reducing that ratio for the country.
The availability of equipment have led to remarkable successes in the Lagos State University Teaching Hospital.
The cochlear implant that we did about two months ago, the bone bridge to ensure that children who have never heard a sound in their life. Here it's a computer chip that is put in the ear that allows even an adult who hasn't heard before can now hear, and then they are taught to speak. Because most people who are dumb, it's not because they can't speak, it's because they can't hear. Okay, so when they start to listen, then we send them, we have a speech therapist here who trains them. And then you must have read in the papers recently, we had a cardiac surgery, open heart surgery. The patient has gone home. We had 2 renal transplantation in the past 6 months. So those are landmark, because there are very few institutions in Nigeria that can do it. And more so, every partner in that exercise are locally. We didn't bring anybody from abroad. They are all indigenous doctors trained in hospitals in Nigeria, but most of them from the last 2 countries.
As the 5th largest economy in Africa, the influx of people in and out of Lagos State increases with each passing day. While this has its economic advantages, it could spell doom for the state in the face of an epidemic. Information sharing played a vital role in the success recorded during the Ebola outbreak in Lagos State. The state is keen on data collection and research.
We have the biosecurity, biosafety, biobanking, bioethics, we call it the B4 committee, which comprises of staffs or officers of the Ministry of Health, the academia, people from Lagos State University Teaching Hospital, LASUT, people from LUT, people from all other academic environments who can contribute effectively to the committee.
Presently, Lagos State has about 40 communicable diseases of public health importance. Tuberculosis, HIV and AIDS, and malaria are of major importance.
The components of the HIV control is you create awareness. When you create awareness, you do HCT, that's HIV counseling and testing. And when you test, if you have clients that are positive, you have to take them on. And there's a new policy now. In the past, we were using a criteria before you place anybody on treatment. You look at the CD4 cell count of 500 per milliliter of blood. But now, the new policy by WHO, which has been adopted by the Federal Ministry of Health and Lagos State government, is that any person that has been tested and is positive for HIV should be placed on treatment. So we observed that we have a lot of advantages in this. It's going to assist in epidemic control. It's going to reduce morbidity and mortality in the individual, and it's going to reduce the risk of spread of infection by that person.
While the efforts of the state government are commendable, gaps still exist. Gaps that represent opportunities for the private sector. The state government is working with the private sector to establish a medical park. When fully functional, it will provide medical services that are not available in the country, which will, in the end, reverse the brain drain and medical tourism.
We reach out to funding partners from time to time. Usually there will be a call for grants, and we try and match our needs to the call for grants. But definitely there's a lot of opportunity because we have the critical mass. Apart from religious gatherings, it's very hard to find, or political gatherings, it's very hard to find 4,000 people looking for health care at a sitting. And this is like a gold mine and an opportunity for development partners to achieve their deliverables. They work with numbers, they want to measure impact. These people are willing and they want to assist you to assist them.
In terms of building, when we are constructing facilities, we are medical doctors. We don't construct facilities ourselves, so we still work with the organized private sector. They are the ones that do all the construction. And in that process, they make their own profit too. So then in terms of drug manufacturing too, and also drug supply, we have what we call joint venture projects in our general hospitals, whereby pharmaceutical companies, they work in conjunction with the MD/CEO of the general hospitals to make sure that they have regular supply of drugs and that people pay for the drugs.
As the state opens its health sector door to the private sector, it is committed to ensuring its residents get quality health care. By establishing the Health Facility Monitoring and Accreditation Agency, the state government makes sure health facilities in Lagos are duly registered and have qualified personnel with current practicing licenses.
And that's where we draw the curtains on this episode of Destination Lagos. Looking for where to invest in human lives? Your destination is Lagos State. You can actually count your return on investments on the number of lives you save in return. I'm Onyi Sunday. Thank you for watching.